Hello and welcome back to my channel. My name is Bridget, a UKRN. On this channel, I talk about migration, everything migration, but I'm not an immigration officer, consultant, or advisor. Neither am I an employer. So everything I share with you is based on experience and research. Today, I'm going to talk about job application tips, how I applied for my jobs that I think probably helped me. Also, I've had the opportunity to go through people's CVs, job application forms, and I've realized some petty mistakes that we make. So I decided to put this video together, send it out, and then enlighten people on how best to apply for their jobs and then probably get better responses. We all understand with this red list, WHO red listing, job application has become very, very tough for some countries. So when you're applying for your job, you need to impress the employer. Aside the red list, the job has become very, very competitive and a lot of people are applying. So what stands you out? Okay, what stands you out is your application, how you do your application. So let's go into this video. My first tip is that please apply to as many jobs as you can. I know it's tough to apply for a single job, example on TRAC jobs, but dedicate time and everything into this. Apply to as many job adverts that you come across. It's a probability. The more you put in, the greater your chances of getting called for an interview. It's like that. And even the more you apply, the greater your chances of applying directly to the trust or the care homes rather than agencies. So let's say you make 10 applications. Chances are maybe out of the 10, one is direct application to an employer or direct application to a trust. So that particular one increases your chances of getting called for an interview. Because not all the job adverts online are advertised by the employers or the NHS trust or the company directly. And with the red list, you have to apply directly to the company. Some of these adverts are by agencies, so they will definitely send you. Unfortunately, we cannot recruit you because they are agents. They can't recruit from red list countries. But the more you apply, the greater the chance of applying directly to a company. I don't know if you get this particular aspect. Then my second tip is that head over to the various websites. So you can head to NHS England, NHS Scotland, Health in Wales, Northern Health and Social Care Trust, that's for Northern Ireland, and then carehomes.co.uk. Please head over to the various websites, create accounts, register your CVs, and look for job vacancies and apply for jobs there. Register your CV. It makes your application much easier and faster. And not forgetting the almighty TRAC jobs. See, I understand people are concerned about TRAC jobs because they get a lot of unfortunate emails from TRAC jobs. Equally, a lot of people have been successful with TRAC jobs. Some even got more than 2 offers. Personally, I got about 2 or 3 interviews from interview invitations from TRAC jobs. It's not that bad. It's the matter of knowing which one belongs to agents and which one belongs to the trust. And it's difficult to differentiate, okay? But keep trying and keep applying, as I mentioned, to as many jobs as you can. I'll leave the links to this websites: NHS England, NHS Scotland, Health in Wales, Northern Health and Social Care Trust, and then the carehomes.co.uk. I'll leave all the links in the description box so you can head over and register your CVs and start job applications, as well as TRAC jobs. Now, my third tip, very, very important to me, is that please read the person specification carefully. Person specification are the things your employer expects you to have, or what they expect you to possess, the qualities, the skills, the experience they expect you to possess before you qualify for the position. So you can meet a person specification that is asking for about 5 or 3 years NHS experience. Okay, that's an example. You don't even have a PIN, NMC PIN yet, to talk of having NHS experience. I understand you may have about 15 years experience in your country, but that is not NHS experience. So with this, don't waste your time on this application because there are more adverts you can apply to. Why waste time on this particular one? Mind you, as you are applying, there are equally nurses in UK with PIN and experience who are applying. So what are your chances? So you make sure you read the person specification very well. Some will specify that they are looking for pre-registered nurses or international nurses. Just apply for those ones and then it will increase your chances. I hope you understand. Then the next thing to consider is please read the job description very well. We've talked about person specification. That's what you're supposed to possess. Job description is your job role or responsibilities, what you are going to do when you are employed. Please read it. The reason I'm asking you to read it is that it's important, or it's advisable to add some of these things in your job application. That's in your supporting information. If it's a CV application, you can edit it and include some of these things in your CV, your responsibilities and your skills. For example, if your job description is talking about neonatal resuscitation, that's for midwives. It's talking about neonatal resuscitation. Please, when you are writing your supporting information, include something about neonatal resuscitation, your knowledge, experience, and skill in neonatal resuscitation in your supporting information. If it's a CV application, if you're applying with only your CV, mention something of that sort in your CV. Just an example I'm giving you, okay? And even this is an interview tip. Most of the time, the questions they ask you on a clinical aspect when it comes to interviews ask about this job description. So for a midwife, you can be asked how you go about neonatal resuscitation in your interview. Like they'll give you a scenario and ask you give the intervention, okay? So please take your job descriptions so very seriously when you're applying for your jobs. The next one is about values. Yes, every company, every institution have values, and this part of the world take their values very, very serious. They treat us in high esteem. So before you can work with them, you have to prove to them that you can adjust with their values. So when you're applying and you know the name of the company or the name of the hospital, the care home, the trust, please just Google the name of the company or the the organization. Read their values and incorporate that in your supporting information or in your CV or in your email, whichever way you are going about it. Just add a bit of it, and you are not just going to state the values of the trust as the values of the trust. You are going to relate it to your own personal values. For example, the trust says that our values are we are compassionate, caring, honest, respect, dignity. These are the values of the trust, or these are the values of the company you are going into. What are you supposed to do? So you can mention it in your own way. Make it yours. Okay, so I'm a compassionate nurse who is honest and keep patient information confidential. This is just an example I'm giving you. Don't go and quote me for my word, okay? So with this, it means with every application you make, you have to make slight editing. I know we all do copy and paste. I'm not against copy and paste, but my point is, when you copy and you are pasting, edit it to suit that particular advert, okay? You don't have to edit the whole thing. Just let's say the values, the responsibilities, the skills, experience, just something small. Introduction will be the same, the end will be the same, everything else might be the same, but then just some slight differences, okay? If you are still watching this video up to this point, kindly like, and if you've not subscribed, please don't be wicked. Kindly subscribe, okay? And when you are done watching, share it with your friends and your colleagues. Also comment to encourage me to do more. Now let's move on to supporting information. So if you are applying for a job online and then it asks you for supporting information, the most common one is TRAC jobs. Please keep your supporting information short and concise. Concise in the sense that it should contain all relevant details, but it shouldn't be too long. It gets boring. You know, you're not the only one applying for the job, and you alone are writing like 3-4 pages. Who should read? And the employer might end up missing very, very vital information. So why don't you keep it simple, but it should carry substance. And then you also treat your supporting information as formal letters, like a formal job application letter, like a cover letter. This is how you treat your supporting information. Same for your emails. If you are sending out an email, it should be formal. So the subject of the email is going to be the title, or like the title of the letter. So job application for position as something of that sort. And mostly I advise that when you're applying, add the position as advertised on the website or wherever you saw. That is, if you've seen an advert and you're applying. I know sometimes you send emails without knowing the job ad because you just came across the email and you're applying. That's fine. But if you know the advert, let's say you know the job title being advertised for. If the job title says pre-registered nurses needed or pre-registered nurse, whatever it is, when you're applying through email, just type job application in the subject, job application as a pre-registered nurse. So as I mentioned, we are treating our supporting information in email as official letters. Okay, so now you come to the salutation. What you have to do is you have to type in dear sir or madam. Fine, you don't need title. I didn't put title for my supporting information, but I always start with dear sir or madam. Now you have your salutation nicely put down because I don't know if the recruiter is a male or female. I've seen people put dear recruiting officer, dear recruiter. Please just keep it simple. Dear sir or madam is official. Once you have that, you come to the introduction of letter. Okay, you introduce yourself. This employer doesn't know you. Okay, for supporting information, I wouldn't advise you to add your name, but for emails, I'll advise you to add your name. So my name is so and so. You end there. This one can also appear in the supporting information. I am a registered general nurse with so and so years of experience, holding a Bachelor of Science degree in nursing. I hope you get my point. Keep it official, but give the details. Keep it simple. Then you go on to mention, I am happy to apply for the position of the title you found online or the title you found on the advert. Let's say pre-registered nurse. So I'm happy to apply for the position of pre-registered nurse. Then further, you go on to add at so and so trust, at so and so care home, at so and so company. You mention the name of the company. It proves to the employer that at least you took a read about everything you saw before contacting them and you are interested. And you are not just applying because you want to apply. I hope you get my point. Yes, they know you are desperate for a job, but they want to know you are desperate to join them before they consider you. Then one other thing I've noticed is people leave out their IELTS or OET, CBT and NMC registration status out of their supporting information, out of their CVs and all other documents. Please, it's important. In your CV, you have to add your IELTS band score, at least the overall band score included. Also add your NMC PRN because you will get a PRN. Add that as well as part of your qualifications or your professional qualifications, where you write your NMC, let's say NMC Ghana or NMC Nigeria qualification. Also add that qualification as well. And then also the CBT. The CBT and the IELTS, you can add it to your trainings, or when I say trainings, I mean your educational background. Okay, you can add those ones there. Then those same information, when you are typing your supporting information, make sure to add them. Tell the employer you've written IELTS, this is your band score. Add your individual band scores for them to know that you meet the individual requirements, and if they contact you for interview, you are not going to waste their time. Maybe your overall band score meets the requirement, but your individual band scores don't meet the requirement. Just provide the overall band score as well as the individual scores. It won't hurt. Okay. Then you also go on to give your NMC PRN, and then you mention which area you apply, you registered for. If it's adult nursing, state adult nursing. If it's mental health, state mental health. If it is midwifery, state midwifery. Then the last thing is your CBT. If you've written CBT, the 2 parts, that's numeracy and clinical, you've passed both. Indicators, just type it there. Then when it comes to the email, please add subscription. Very nice one. When you finish typing everything, attach your documents. You put a subscription, kind regards. It should be nice and formal. Your full name, your phone number. But if you are typing your phone number, remember to add your country code. Very important. This is an international application, so your country code is relevant. Same for your CV. If you have your contacts on your CV, add your country code. Now we are moving on to the next step. I'm going to talk about how we arrange our trainings, educational qualifications, professional qualifications, referees, even referees. Yes, I believe all these things should work in chronological order. I know some people already work some other ones in chronological order, but not referees. I prefer to work my referees in chronological order. Chronological order in the sense that the immediate one comes first. So let's take your educational qualification. The school you completed most recently should come first. And so let's say you've schooled up to university level. That's first degree. Your first degree should come first, then your senior high school or your high school, followed by, let's say, your basic school, and in that order. Okay, I'm not saying they are all relevant. I'm just working things out for you to understand. Then it's going to work the same way for your work experience. So where you are working currently or where you work most recently comes first, and then the rest follows in that order. Same for trainings. The training you had most recent should come first. If you had a training in 2019 and you've had training in 2022 must come first and the rest follows in that order. For referees, the reason I believe it should also work in chronological order is because your current employer can cover up to the number of years they require of you. Maybe they want up to 3 years experience, 3 years reference, and you've been with your current employer for about 5 years. This employer is definitely going to cover all these 3 years and you don't need any extra. But if you provide an old employer, okay, and they know you up to a certain period, not covering up to the recent, then you will need to provide your current employer as well. I don't know if you get it. Yeah, so I always advise that work in chronological order. Let your first employer come first. And I know they are likely to contact their first referee before the others. Then one other important aspect, okay, to make you stand out is what you've got to offer your employer. You are applying, someone else is applying. Let's say you're applying from Ghana, a Nigerian is applying, a South African is applying. Just giving examples, okay? All these people are applying for jobs. For the same job you're applying for, why should the employer pick you and not them? So the question is, what have you got to offer us that these other people applying can't offer us? This is where most employers draw to pick candidates for interviews. So I will advise that even the tiny little bits you can do, please put it in your CV to cover your skills, okay? Most of the time when it comes to skills, we talk about good communicator, competence, blah, blah, blah. Let's put those ones in the values, okay? Then when it comes to your skills, please, the hands-on thing you can do. For example, if you can pass cannula, it's a big deal to pass cannula in UK. I know it's a simple procedure. Back where I come from, if you're a health worker, you can't pass cannula, we look at you somewhere. But over here, you need training to pass cannula. You don't have to prick a patient more than a certain number of times. You see what I mean? So you can't just go about and say cannulation is normal. No, it's not normal over here. You need training. So if you can cannulate a patient, it's a plus. You can add it to your CV or your supporting information in your skills. You can also add, even if you can perform ECG or monitor cardiac activity, you can add it. If you can perform drug administration procedure accurately, and you've not had any issues before in drug administration, especially IV drug administration, include it. Even maybe you are the best person at decontamination, okay? You know how to decontaminate, or you know proper personal hygiene, or let me say proper hygiene procedures, proper waste segregation processes. Stand out. Let them understand that when you arrive, there are certain things you will be able to do, and like it's going to benefit the company. So even though you are going to receive training for cannulation, because you have the experience, they know that once you are going through the training, it's not going to be a difficult thing. Now, my last point is, this is entirely personal. I'm a Christian. You may be a Muslim. You may not be a believer at all. Please support your applications with prayers. This is entirely up to you. I think prayers also help me. So if I'm sharing my tips with you, I have to add it. Thank you for watching this video. Kindly subscribe, like, share, and comment.